Okay, we might get started with today's webinar. Today we're going to be looking at what are the legal obligations for recalls and reminders compared to preventative health initiatives. So this is, recalls and reminders is actually one of those topics that keeps coming up, and it's probably one of the things that I get asked about the most. So we thought it was a good idea to then run a webinar, get to sort of address a lot of those frequently asked questions, and offer obviously an opportunity for you guys to ask any questions as they come up. So what are we going to cover today? We're going to be looking at the key differences and the legal implications of recalls and reminders. And there are differences between recalls and reminders, even though those terms tend to be thrown around interchangeably. And we'll also have a look at what are the components of a robust patient recall system. We'll look at some of the accreditation standards that relate to recall systems, and we'll also explore some of the pros and cons of doing recalls via mobile phone. So first things first, what's the difference between recalls versus reminders? So again, recalls and reminders, the terms get used interchangeably. Partly the reason for this is because different clinical software packages have used them interchangeably, but from a legal point of view, from specifically a medical legal point of view, there is actually quite a big difference between recalls and reminders. So if we're looking at recalls, when we talk about a recall, the easiest thing, at least for me to remember, a recall is the need to bring someone or call someone again. So to call again, it means that this is for instances where we need to get the patient back in the clinic. So examples of this would be abnormal test results or investigation results from things like x-rays, or even reports that come back from specialists that need to be discussed with the GP. So again, it's not for every single report that comes back, it's just the ones that have some kind of abnormality where the GP needs to have a chat with the patient. In terms of medical legal requirements for recalls, we have to make reasonable efforts to contact the patient to ensure that they actually book and attend that recall appointment. Okay? There is, you'll hear a lot of different versions of what reasonable efforts are, but the key thing that I need to highlight is there is a legal responsibility to make sure that you chase these patients up. It's not good enough to just kind of contact them once and then it's up to them if they turn up or not. That's actually not good enough. This also would apply, so the same medical legal requirement applies to investigations that a GP might request where they feel like the result is likely going to be clinically significant. So this is the GP's clinical judgment. They go, I've got this patient here because of the symptoms and the way that they're presenting. I have a fairly big suspicion that the result is going to be something that's going to be quite significant. It's not just I'm just kind of screening, checking that there's nothing wrong here. If that's the case, there is actually also a legal responsibility to make sure that patient actually attends that appointment, or that they actually have that service. They actually undertake that investigation, blood test, whatever it is. It's the common scenario is a chest X-ray for someone that the GP is sort of quite concerned that it might be lung cancer or something like that. In that instance, you would actually want to create a little recall to remind yourself not just to obviously check on that patient, but check that the patient actually had that test done, which a lot of the times we wouldn't know unless we knew to check, because we don't usually, or a lot of the clinics don't usually check that every single test that they send people out to do is actually performed. That would be the ideal, but it's not really feasible in a lot of instances. So the legal implication is really for those that the GP feels are going to be clinically significant. So aside from that, from those ones, but then also as soon as we get an abnormal test result, the best practice approach seems to be 3 notification attempts, and that could be using a variety of methods. So that could be a phone call, or it could be a letter, or it could be via mobile phone, which I'll talk about in more detail later on. And then the final attempt should be a registered post, so a letter via registered post. The reason for this, 3 notification attempts is obviously because we're that's sort of considered to be the reasonable effort to try and contact and bring that patient in. Sometimes people will go to the extent of using the next of kin, contacting the next of kin if they're really desperate to try and get a hold of that patient, or they might, I know in the past, clinics have contacted Medicare if for whatever reason they no longer seem to have the most recent contact number, or they can't, they get a return to sender from the letter. So that some clinics have contacted Medicare to say, look, there's an outstanding or there's a critical appointment needed for this patient. If you're able to get a hold of the patient, please let them know that we at the moment don't have their current contact details, so please get in touch with us. Obviously, you would not share what the issue is or why they need to make the appointment, but there is an avenue potentially there to go back to Medicare. Although usually, at least in my experience, a lot of times Medicare doesn't get updated as frequently as we would hope. So that's recalls. So recalls are the ones that have all the weight in terms of legal requirements. And again, it's for abnormal test results or for events where we send a patient to have some kind of test or investigation, and we really, really, really want to make sure that they have that test done. Okay? The next item is reminders. So reminders are completely different type of thing, because this is mainly used for health promotion and prevention. So this is just more, as the word says, a reminder or a prompt for a health promotion activity. So we tend to use reminders for immunizations, for routine pap smear notifications, for health assessments, care plans, reviews of care plans, or other kinds of reviews. So those are the kind of things where there isn't anything abnormal going on. We're just wanting to stay on top of things and make sure that obviously our patients get good quality and comprehensive care. There is no legal requirement to either send or follow up reminders. You are not going to be in trouble if you didn't send an immunization that was due for a child or even an adult. You're not going to be in trouble if you didn't send a routine pap smear notification to your patient. Having said that, even though there's no legal requirement for something that is a health promotion or prevention activity, there is accreditation. From an accreditation point of view, there is an expectation that you will have a system in place to address these things. Also, it's just best practice and it's good quality, obviously, patient care. So big difference between recalls and reminders. Recalls, think abnormal results, abnormal tests, things that we need to bring the patient back in for. Reminders are more routine things, health promotion things, and reviews and care plans and the like. So just a very quick pop quiz. Is it a recall or a reminder? If we have a pap smear, is a pap smear technically a recall or is it a reminder? I'll give you a second to think about that. Cast your vote. And the answer is it actually depends. So if the patient is due for a routine pap test, a routine pap smear would be a reminder that we would be sending. That's a health promotion initiative. But on the other hand, if the patient has had their pap test and the doctor wants to discuss the results because it was abnormal or there were some abnormalities, then now that's actually a recall. So hopefully that's clear, the difference between when it's a reminder, which is just a routine, inviting them for a health promotion activity, versus we have an abnormal result, now that's a recall. Yeah. All right. So the other common question that we get is about patient opt-outs. Can a patient opt out of recalls and reminders? Now, when we're talking about recalls, remembering that when I say recalls, I'm talking about those abnormal test results. Patients cannot opt out of receiving recalls for things like abnormal tests or investigation results or reports that need to be discussed with the GP. Having said that, for reminders, completely different story. Not only can patients opt out, this is actually part of our accreditation requirements that we need to let patients know, even if we're only sending letters. So forget about SMSs or anything like that. Doesn't matter how we're sending out health promotion information or how we're letting people know that they're due for the pap smears. If it's a reminder, patients can opt out. And it doesn't matter in what format. You should actually be using signs in your waiting room to inform patients that they can opt out of health promotion reminders, but also use it, make sure that that's noted in your practice information sheet. And also if you have a practice website, that's also included in your practice website, that people can opt out of health promotion reminders. The other tip that obviously a lot of clinics use is they include this information in the patient registration form. Not only the fact that they can opt out, but they actually have an opt-in so that people can specifically decide that, yeah, I'm quite happy to receive information in all these different methods, or no, I don't want to receive information in these formats. So by that I mean, a patient might be quite happy to receive information, via phone, but they might say, look, don't send me letters or don't send me SMSs. Yeah, or they go, yep, I'm happy with SMS. I don't want phone calls though, or I don't want, letters, whatever it is. Yeah? Remember that this is only applicable to the reminders that are more the health promotion, prevention type stuff. We do see a lot of clinics where they've taken the process that they use for the recalls and they've applied it across the board. So for a routine pap smear, they're sending three contact attempts and sending registered posts. Now, obviously there's nothing stopping you from doing that, but it is far and above way more than is required from a medical legal point of view. That's not to say that you wouldn't want to try and get these patients in for these services, because obviously those services are important and it's a good idea for patients to have those services. But you definitely don't need to go to that extent for something that is just a reminder or a prompt for a health promotion or prevention activity. Okay. Now, let's talk about a recall system. So what are the components, or what's required to have if you want to have a robust and solid recall and reminder system? So any decent recall and reminder system will include the following. First, before we even touch the actual recall system, we need to have high quality of the information, of the data in both your clinical software and your admin software. What do I mean by high quality and what we call clean data? That's coded diagnosis. So for example, when you're adding in their history what someone's due for, what conditions a person has, you need to make sure that you ideally pick from the list. So there's usually a list of coded diagnoses instead of just free typing or free texting different things every single time you're entering something. The other thing is the list of recalls, the list of recall reasons. It's a good idea to get the whole practice to agree on what's going to be the list, or have a set list, so you prevent a lot of duplication. And for example, we see this all the time whenever we install and set up smart recalls. People, like clinics, are using 7 different ways of saying a routine pap smear. You have routine pap smear, routine pap smear, repeat smear, regular smear. So instead of having all these variations, there are ways in most software where you can lock that list. So you again obviously want to make sure that you have an agreed list, but that way you know that you're not going to have an unmanageable amount of fairly cluttered information. The other thing that you want to make sure that you have is a documented policy and process about what the recall and reminder process is in your practice policy and procedure manual. That is an accreditation requirement. Needs to be outlined. Make sure that it's something that makes sense and it's written in a user-friendly language, because the next thing that you want to make sure is that you're training practice staff as part of their induction or orientation, or ideally even as a refresher if needed, on what is your process for recall and reminders. Then the next thing you want to make sure is that there's a consistent approach to entering that information, that you're not having 3 different staff members, and by that I mean, it could be doctors or it could be nurses, where everybody is entering information differently into the software, either using different wording or using different criteria as to what they put in as a recall and reminder. You also want to make sure, so this is the steps, obviously as soon as we get started, you want to make sure that all results that are received, so once we've sent a patient off to have a test result or investigation, all results that are received, they are reviewed by a clinician, because sometimes it's not the clinician that ordered them if that person is away, that they're reviewed and signed, usually either digitally or physically if you have a hard copy, that they're actioned. Even if the action is no action needed, that is still a form of action. Or obviously the other possible actions might be for the nurse to discuss or have a discussion with the patient, or for the patient to come back in and discuss with the GP, or an urgent discussion. So usually that means bringing them in the next 24 hours. And making sure that obviously this is then a copy of this is in the patient file. So a copy of that result and whatever the action was annotated in the patient file. So 9 times out of 10 is going to be you've got a normal test result that comes back. The GP reviews it, they go no further action, and then that gets entered into the patient file, which usually happens automatically with a lot of the clinical softwares. You also want to make sure that there's a documented trail of any recall-related patient contacts or attempts that you have. So either, every time that you rang a patient, especially, remember this is for recalls, so for abnormal stuff, you want to have evidence of every time you've rung them for something, if you've had phone discussions, if you've managed to book them in. But the other thing that people forget is once you book them in, that's not the end of the story. We have to have something in place to make sure that they attend that consultation, because, and this is sort of best practice, if they fail to attend that results or that recall appointment, then we really should start the process again. So we add them back on our recall list and we start the process again of 3 phone calls and a letter. One of the ways that many clinics use is there's ways in admin software to highlight the type of appointment. So some clinics will just highlight that it's a results appointment. And so if it's a results appointment and the patient doesn't turn up, we don't just ignore it. That one, we actually chase that patient up, or we give that name to the GP to let them know, or we give that name to the nurses to follow up or add again to the recall list. So now let's talk a little bit about the accreditation standards that relate to recalls and reminders. So in terms of obviously the accreditation standards, we have a lot of accreditation standards, a lot of criterion within those standards, but the main ones that will touch or relate in one way or another to recalls and reminders are going to be the ones that talk about prevention and health promotion, the ones that talk about systems to follow up tests and results, the ones on patient identification, and privacy and confidentiality. And I'm actually going to go into some of these in a bit more detail now. So one of them is criterion 1.3.1, which is health promotion and preventive care. With this one, in our standards, so this is our RSCGP standards, it dictates that practices need a systematic approach to health promotion and preventative care in order to obviously to promote early detection and intervention. The suggested methods, because there is no one way that this can be done, but the suggested methods in the standards are the use of patient prevention surveys. So this could either be a screening tool that or screening questions that you might be using in say in the waiting room or before the patient actually comes in to see the GP, or for example things like the AUSDI risk, that's the Australian Diabetes Risk Questionnaire, where you can the patient fills that out and then we can calculate the risk of type 2 diabetes. The other thing is having disease registers. So again, most clinical software already has built into it the ability to kind of track or search by disease. So with a disease register, what that means is, again, we need to be using coded diagnoses, so picking from the list and not free texting things in, because that's the only way, if it's coded, that's the only way that the clinical software can then, in the background, we can do searches for for our diabetic patients, or we can use audit tools that allow us to see the information for those patients, and say, for example, some of the audit tools allow you to check components of the diabetes cycle of care, and all. If we're not tagging them correctly using the coded diagnoses, then those patients will not be picked up. So whenever we free text, it doesn't really get picked up by the system as or recognized as them having that condition. Yeah. So the other option that RSCGP proposes, or the standards propose, that we can use or do health promotion and prevention is obviously having a recall and reminder system, where we're routinely sending invitations for things like pap smears, immunizations, and other checks. The only proviso is that make sure that this needs to operate in a way that protects the privacy and confidentiality of patient health information. And I'll talk about this in a little bit. The last point that they make is that you have to make sure that whatever preventative activities you are using or doing in your practice, that they're based on best available evidence, and that ideally they incorporate the use of clinical guidelines. Now, whenever we do any kind of webinar or we have our CPD modules, we always all the information is based on our sort of approved best practice guidelines. At the end, so usually the following week after the webinar, as you know, we post the recording, and in that post we have links to all the different resources that I cover in the webinar. So what I'll do is I'll add a link there to the list of clinical guidelines that is listed in the RSCGP website. So that's where you can have, you can access the diabetes guidelines. There's guidelines for prevention activities in general practice. There's guidelines for, I believe, arthritis, for care in the elderly. There's a truckload of there's no shortage of guidelines, that's for sure. And obviously what guidelines provide us with is the framework, or what are the steps, what's best practice. Okay, so make sure that it's not just something that you came up with that you thought, yeah, this is a good idea. It's like, well, is it based on evidence? Is it backed up? And that's where the guidelines fit in. So the other criterion from accreditation is 1.5.3, which is system for follow-up of tests and results. And this dictates that all pathology results, imaging reports, investigation reports from things like specialists and things like that, they all, as we said before, need to be reviewed by our GP, signed or the electronic equivalent, acted upon in a timely manner. It's not really good enough for test results to sit there for weeks at a time. Things should be checked daily, at a worst case scenario every second day. Because again, we don't know what results are going to be there that are needing to be acted on urgently. And then things need to be obviously documented in the patient file, and ensure that there's obviously the process that we follow for all of this is documented in our policy and procedure manual. The other criterion that is relevant is 3.1.4, which is patient identification. And we have this thing about using 3 patient identifiers. So this is sort of the main reason for this is to make sure that obviously we've got either the right patient in front of us, or we've got the right patient file that we've opened up. So this should really be applied when making appointments, when writing prescriptions, writing referrals, giving results, or entering any correspondence, because those are the chances where we could very easily, if we have a couple of patients with similar or even the same name, which happens, we could end up entering information in the wrong file, or giving, prescribing a script for the wrong patient, or giving, private health information, critical health information to the wrong person. So the most common and sort of the most practice-friendly identifiers tend to be patient name, date of birth, and address. So as an example, if someone's ringing the clinic and they're booking an appointment, the questions that you'd want the receptionist or whoever's making that booking would be, okay, what's your full name? Confirm full name. Can I just confirm your date of birth? And what's your address, or confirm their address. That way we make sure that we've actually got the right person, that we've opened the right file, that we've allocated the right patient to the appointment. And this should actually not just happen at that point, but when they come into the consulting room, again, check date of birth, check the address. The other thing that this allows us to do is it prevents that issue of sending people off for test results, and then when their test results we find out that when we're trying to reach them, their contact details are out of date. So if we are doing that 3 patient identifier, usually it's a perfect opportunity to go have any of your other details changed, phone number and things like that. So it seems like a lot of work, but again, if you think about it, imagine yourself as a patient yourself, and being in hospital or going to a GP, the last thing you want is for there's another patient who seems to have a similar or same name, and all of a sudden your history spread out, or you're getting treatments that are not really meant for you, they're meant for someone else. So it is important. So the last thing I wanted to, well, not the last thing, but almost closer to last thing I wanted to look at was the recalls via mobile. So we're seeing that this is becoming more and more popular for many reasons, but I wanted to make sure that we cover the pros and the cons. So what are the benefits and the disadvantages of doing recalling people? And when I say recalls, it's not just obviously recalling them for abnormal stuff, but also for the reminders. So using using mobile phone to send out for recalls and reminders. So what are some of the benefits of being able to send via mobile phone? Obviously, the cost is a lot less than with letters. Now the cost of stamps has gone up and made big mail outs not very financially viable for most clinics. It also obviously saves paper if we're sending notifications via mobile. It's much more environmentally friendly. Saves staff time, especially if you have a system that's automated, it can be customized, like with smart recalls. Much better reach, and this is because, and you probably, again, like this is anecdotally, and this is based on my own experience in practice and my own experience as a human being living in society. Patients tend to change address much more frequently than they do change their mobile numbers. Again, I don't know how many of you have changed addresses in the past, few years, but still have the same mobile number that you had, 5, 10 years ago. I still have the same number that I had, I think, 11 or 12 years ago, and I've definitely changed addresses much more frequently than that. So if a previous clinic was trying to reach me via letter to one of my previous addresses, it's highly unlikely that it would reach me now. But if they either send me a mobile message or rang me on my mobile, they would very likely reach me. The other thing that we've noticed with the SMS is that they actually can have better uptake in terms of converting to an actual appointment. Part of the reason for this is because obviously you've got the phone in your hand, so it's a lot easier to trigger that immediate phone call to book the appointment then and there. The other thing is, depending on the service that you're using, for example with smart recalls, you have the built-in functionality to allow the patient to book online right then and there, so they don't have to, because obviously sometimes when you call a medical center, depending on the time that you call, you might be on hold for a few minutes. And if you're busy, it's just easier to book online sometimes. So in terms of the disadvantages, obviously, it can be a great initiative to implement in a practice, sending out your notifications via mobile phone, but it's not going to suit absolutely everybody. There are some disadvantages. One of them obviously is you're not going to be able to reach patients who do not have a mobile phone. So sometimes older patients may not have a mobile phone, or just even just younger patients that for whatever reason have shunned away from mobile. Very, very rare in this day and age, but it can happen. The other issue is messages can be very easily sent to the wrong person if the mobile number that you've recorded is wrong by even just one digit. And that can happen so easily. If you think about, obviously, the rush of, when we've got new patients coming in, we're entering that information in a rush, it can happen quite easily. One of the issues with that is, again, with that privacy, is some of the systems that are out there for messaging do not really have any privacy safeguards or any verification steps, which obviously with smart recalls, we made sure that we built that in there. So again, it's very easy. If you have the mobile number wrong by a digit, all of a sudden you're sending information that could be quite, confidential information to a complete stranger that has no business looking at that information. So in kind of like a quick summary, what are the signs of a good recall and reminder system? You want to make sure that it's overall complying with the RCGP standards, which obviously I covered a lot of those steps. That it's using that 3-point identity verification process, that at the end of the day that is actually saving staff time and that it's reducing costs. And cost is a big issue for GP clinics because obviously we've all heard of the Medicare rebate freeze, but it's actually it's quite difficult nowadays to run a financially viable practice, especially if you're doing a lot of bulk billing. So it is important to always be mindful of what are some of the ways where we can use staff more effectively and reduce costs. Obviously, as long as it's not going to impact on the quality of the care that we provide to our patients. The other thing is making sure that a good recall and reminder system is going to be audit safe, because it's going to have documentation of notification attempts, and there's going to be steps in there to check that those patients were successfully either notified or that they actually successfully, booked an appointment. Now, just to wrap up, I just wanted to talk about some of the tools that can help you in your practice. And obviously, some of you listening might already be using Smart Recalls. But Smart Recalls is a HotDoc service and product. And the idea of Smart Recalls, it was designed to kind of help alleviate some of the pains around the recalls and reminders. It detects the recalls and reminders from ZMed Best Practice and Medical Director. It sends the notification securely to the patient's mobile using a 3-point identity verification, and I'll show you some screenshots of what that looks like. And then it actually provides to you the practice in the dashboard. There's a practice dashboard with real-time tracking of how those notifications are going, whether they've been sent, received, read, and you can even track if appointments have been booked. Now, having said this, when I talk about it detects the recalls and reminders, it's usually what it's reading. It's going to be reading the reminders or the health promotion kind of side of your software, because most software has split up results, pathology results that come in electronic format, and that's split it up from the other reminders that you enter for, things like immunizations and things like that. A lot of them will automatically go across once, someone's kind of marked as, discussed or things like that, but some of them don't. Like some of them actually depend on, say, the nurse or the GP to create a reminder, in which case then it will be picked up by HotDoc. So, because HotDoc can't actually read the test results section. We read the list of reminders section, which is also called recalls, which is why, and some clinical software, which is where a lot of the confusion in the past has led with the interchangeable use of recalls and reminders. But this is what it looks like from the patient point of view. So with Smart Recalls, the patient, so the system will detect that the patient is due for a recall. The clinic actually sets a lot of parameters, so you can customize, the message that goes out, and even, there's a lot of other, like when the message goes out. And so the first thing is that the patient will receive an SMS that has fairly generic information that says, hi, whatever the name of the patient is, you're due to book an appointment, click on this link. And that link is actually a secure, unique link for that one patient, for that one recall. Then it'll take them to this verification page. So this is where we can do a 3-point identity verification, where they would confirm last name, date of birth, verify. Obviously, we already have their mobile number, so it becomes a third option for verification. So what this safeguards from is if we did have a wrong mobile number for somebody, even if it was just by a digit, and this is sent to the wrong person is not going to be able to verify, with the last name and date of birth. If it's incorrect phone number. So already this is a way of safeguarding or protecting that private and confidential information from eyes that have no business looking at them. So once a patient successfully verifies the information, that's when they can see the full content of their recall or reminder letter. The other thing that we've done is we've created, the focus has always been on using patient-friendly language and making things very succinct and kind of not just saying you're due for a diabetes review. It's like, but why is a diabetes review important? So we actually have templates for all of, for the most common kind of recall or reminder reasons built into it. And they can all be customized as well. If you have your own wording that seems to work quite well, that's also another option. The other thing is, obviously, as you can see, if you've got the HotDoc online appointments, you can link it directly so that from that message they can book an appointment directly online. Or you can make it so that, they just, some appointment types, some people say I just want them to book over the phone because, it might be a complicated booking setup where they might need to see the nurse for 30 minutes and then the GP for 15 minutes or whatever it is. So it's just easier if they call. That's fine. We can eliminate that and they can just, click on the phone number and call the practice. As I mentioned before, there is a practice dashboard, which is where you can manage all of your recalls. All of the information that's there, that's all a sample database. None of that is real patient data. And the idea of the dashboard is you can track status of recall notifications. That's in real time as things are happening. You can see all the contact attempts and where they're at. You can see if a patient has received the message, if they've read the notice, because we can actually track whether or not they've verified their details and seen the actual message. And it also manages letters internally. So if you wanted to do your mobile contact attempts and then finish it off with a letter, we can actually do mail merges from there, and they print in your own printer, but all the content that you're using for the templates for the messages is the same thing that then gets replicated in a letter with your letterhead. All the progress is also automatically updated in the patient file, so as soon as any of those steps happen, when messages are sent, or if I print a letter, if the patient verifies, all of that is added in the patient file. The other thing is you can set it up and you can decide how many attempts you want with mobile messages. So you might say, look, I just want to send them one message, or I want to send them two, or I want to send them three, and the final one I'll do a letter with it. So again, all of that can be customized. Obviously, some of the benefits of using something like this is that it saves truckload of staff time. You can track the status of recalls like never before, because it's obviously very, very easy to see things in real time. Definitely reduces costs if you're currently doing letters. And then you can also obviously manage mail merges centrally. We are doing a special offer. If you're new to recalls, you can actually just mention that you've attended this webinar, or that you've seen the recording for this webinar. You can get 1,000 free credits to get you started, as long as obviously this happens, as long as you contact the team before the 15th of Feb of this year. So if you haven't tried it, you can get 1,000 free credits to check it out, see if it's going to be suitable for your clinic. And 9 times out of 10, it usually is. So I would highly recommend that you check it out. And the other thing is, when we first activate them, some practices actually will start with just one recall type. So for example, they might start testing it just with their pap smears, for example, to see how they're going. So and then once they're comfortable with that, once the admin staff is comfortable with that, once they see that the patients are finding it convenient, then expand it out to all other reasons. The other product that I wanted to talk about, just because it's new and it's launching now, is HotDoc Inform. So this is just a way where, when people have confirmed appointments, you can actually target them or show them targeted information about other services that your practice is offering. So so as you can see on the right, there's a patient message as soon as they confirm an appointment. So this is on the back of a reminder. If they confirm an appointment, they get that little quick message, and you can actually, from the dashboard, you can turn on and off the different campaigns. So you might say, look, I'm happy to, there's a set of basic campaigns for things like, HotDoc bookings, so for them to install the app, or for My Health Record, for clinics that are in areas where it's still an opt-in process and instead of an opt-out for My Health Record. So again, that's encouraging patients to get their My Health Record set up before they come in and see you, and it's got the link for them to set it up. If you wanted to let them know about skin checks, or if you're doing smart recalls, again, letting them know about that. And then there's the premium campaigns that are even more targeted. So there's things like men's health check, travel vaccines, chronic conditions, that would be for care plans, the over 75 health checks, flu clinics, the 45 to 49 year health check, the diabetes check, and if you're doing shingles vaccinations as well. And again, so all of these can be switched on or off at any time depending on what the focus is of your clinic. So obviously when you're going through flu season, perfect, you can click the flu clinic campaign on for that time, and then as soon as that's no longer a thing, switch it off. So it's just, again, it's another great way of targeting, and the targeting is actually based on age. Usually so someone in their 50s won't get a 45 to 49-year-old health check promotion thing. And again, like the wording of them, of those, that we have templates for all of those, and the wording is very patient friendly, very much highlighting the benefits. So again, if you're interested in that, just contact the HotDoc team, and they can walk you through it and show you how it works.